Welcome to Managing Medical Bills. During this seminar, all participants will be in a listen-only mode. There will be a question and answer session at the end of the presentation using questions submitted through the Q&A feature. Please remember that information provided in this web seminar is not intended as a substitute for your physician's guidance and care. We would like to thank Blueprint Medicines, Genentech, Decipher, and Novartis for their educational grants for today's webinar. My name is Sarah Rothschild. I'm the Executive Director of the LifeRaft Group, and I would like to introduce our presenter for today. Melissa is a staff attorney at Triage Cancer, where she provides education on the legal and financial issues that may occur after a cancer diagnosis. Prior to joining Triage Cancer, Melissa ran the health law partnerships at the Legal Aid Society of Southwest Ohio. Before law school, Melissa served as an urban youth development volunteer with the U.S. Peace Corps in Paraguay, where she became fluent in Spanish. She also worked as a case manager in the foster care system in Hillsborough County, Florida. Melissa attended Ohio State University, where she graduated with a JD MA dual degree from the Moritz College of Law and John Glenn School of Public Affairs, and she graduated cum laude with a BA in Sociology and Anthropology from Tulane University. She's a member of the Ohio Bar. But most importantly, we're very excited for her to speak with us today about managing medical bills. So you can proceed with your presentation.
Awesome, thank you so much. As Sarah said, my name is Melissa Salomon. I am a staff attorney at Triage Cancer, and I'll be talking to you all today about managing medical bills. But before we get started, I do want to just tell you a little bit about Triage Cancer and what we do so that you know where to go for more information or where you can send others. Triage Cancer is a national nonprofit organization that provides free education on the legal and practical issues that may impact individuals who are diagnosed with cancer and their caregivers. We offer our education and resources through many different platforms, including through various events. And one of those events is our free Triage Cancer Conference. This is a full one-day event that is designed for individuals with cancer, caregivers, advocates, and healthcare professionals. We cover a huge range of topics, including everything from advocating both with the legislature or different agencies to picking out health insurance and even how to reduce stress. For example, we talk about how to balance work and treatment and ways to manage medical bills. Our next conference is going to be on October 1st. Hopefully live and in person in Chicago. And if you have any interest in registering for a conference, you can go to our website at triagecancer.org. All of our events, both online and live, have free CEs for nurses, social workers, patient advocates, and HR professionals. We also host a monthly webinar series, which is open to anyone. These provide really an in-depth discussion about one particular topic. We cover things like finances, insurance, employment, planning ahead, caregiving, and a whole bunch more. You can see on the slide our upcoming webinars over the next few months. We also make our webinars available online after they are completed so that if you miss it or you want to hear it again, you can check out the recording on our website. To register for those, you would go to triagecancer.org/webinars. In addition to the events that we offer, we also have a whole bunch of free educational materials and resources. So we have a bunch of different quick guides and checklists that provide information and overviews of important topics that we think impact people who have a cancer diagnosis or their caregivers. They can guide you through managing medical bills, understanding your options at work, accessing health insurance, trying to figure out when to apply for disability, and all kinds of different things. And my favorite of these materials are actually the checklists and spreadsheets. And I think that they can really just help guide you through the decision-making process. So be sure to check those out. All of these materials can be downloaded from our website. And for anybody who is in a healthcare profession, we do provide bulk orders, physical copies by mail. We also have a practical guide, which is kind of like a one-stop shop that covers some of the cancer rights law topics that people have to deal with in some way or another after a cancer diagnosis, things like employment, insurance, and finances. In addition to our original cancer rights guide, we have some that were created for some special populations. So we have one for young adults, one for seniors, and one for caregivers. And both our original guide and caregiver guide are also available in Spanish. These two are available on our website. And then when you go to our website, you'll see that we have all of our resources organized in a couple of different ways. One of those ways is by topic. So this can be helpful to see all the resources that we have related to the various topics that we discussed, things like insurance, finances, stress management, all the different topics there. We also have state-specific resources, which include contact information for useful programs in your area. So, for example, if you were looking for information on your local Social Security office, or how to apply for Medicaid, how to find legal help in your area, or where to file an insurance appeal, all of that information is on the state resource page. And because where you live can impact what protections you have access to, we have a chart of state laws on employment, disability, health insurance, accessing medical records, and a whole bunch of other topics. Our charts are frequently updated based on the changes to federal and state laws that impact them. We also know that people learn in different ways. So we have animated videos on some of the key topics that we talk about. Some of them are listed up here on the slide, and we're always adding more. They're all about 5 minutes long and are available in multiple languages and really help provide an overview on the topic or an introduction to it when it can be confusing or a lot of information when you're reading it. So we think that they kind of simplify it and really help provide an intro. Cancerfinances.org is a resource that provides practical information on topics impacting finances. And this one is designed to guide you through to the information that's most relevant to your particular situation and can also connect you to financial assistance resources. We at Triage Cancer do not provide financial assistance, but we do keep a list of a whole bunch of different resources available out there so that people have it all in one place to locate. And then for information about current events or topics, you can check out our educational blog. It not only provides great information about substantive topics, but because things are constantly changing in the cancer community, this is how we share any breaking news or advocacy opportunities. If you want to subscribe, you can hold your smartphone up over the QR code and it would direct you to the right page on our website. And then we also have a monthly newsletter, and there we share any new resources that we've developed and our upcoming events. But today we're here to talk about managing medical bills. And so while we may feel the urge to adopt this guy's strategy of leaving the bills unopened, that is not a coping strategy that I would recommend. However, there are a few things that you can do to reduce the burden of medical bills. And it doesn't necessarily just have to happen during your initial cancer treatment, but could be used during surveillance or follow-up care. And really the tips that I'm going to share today are things that all of us as consumers could consider as we're getting any type of healthcare. The first way and most important way to manage your medical bills is actually to understand and make sure that you have adequate health insurance. So I want to briefly talk about health insurance, and then we're going to get into the bills themselves. So in the US, there are 3 places where we can get our health insurance. We can get it directly from the health insurance company, so like through the marketplace or a broker. You could also get it through the government, and by that I mean Medicare, Medicaid, a military or veterans plan, or a state or local program. And then about 50% of us in the US still get our health insurance through our employers. But no matter where you get it from, it's really important to understand these key terms so that you can better understand your coverage and make the best use of it. The first term I want to talk about is premium, and that is the cost that you pay each month just to have health insurance. If you never get care during the year, you still have to pay your monthly premium. And then there are the costs that we pay when we go and we get certain types of care. So first we have to pay our annual deductible, and that's a fixed dollar amount. And you have to pay that fixed dollar amount out of pocket first before your insurance is going to kick in and start paying anything for your medical expense. You could have a deductible that's $500. You could have one that's $5,000. It's really all going to depend on the type of policy that you have. And there are plans that even have a $0 deductible. And then there's something called the copayment. And the copayment is a fixed dollar amount that you pay each time you go to get care. And so maybe you have a $10 copay to go to see the doctor, maybe a $30 copay for a specialist, or a $200 copay to go to the emergency room. The amount is going to depend completely on your coverage. And often you can find that information on your health insurance card. But if it's not there, you should definitely check with your health insurance company to make sure that you understand what's expected of you each time you go to the doctor. And then the copayment is different from coinsurance or cost share. And those are two terms that are used in the same way. And so that is the difference between what our health insurance company is going to pay for our medical expenses and what we pay for our medical expenses. So we might have an 80-20 plan where insurance is going to pay 80% and we pay 20%. And then the out-of-pocket maximum is probably the most important thing that you should know about your health insurance policy. Because in a worst case scenario, it's the most that you're going to have to pay out of pocket for your medical expenses during the year. And it's a fixed dollar amount. So you could have a $1,000 out of pocket, or you might have a $20,000 out of pocket. Again, that's going to depend on the coverage that you have. And the way that you reach your out of pocket is you add up the deductible, the copayment, and the coinsurance. And once you hit the out of pocket maximum, your insurance is going to kick in at 100% for the rest of the year. Now, it is important to remember that some plans will carve out the deductibles from the out of pocket max. So when you're signing up for health insurance, you're going to want to make sure to keep an eye on that. And I want to take a look at an example of how the out-of-pocket max actually works. So we're going to talk about Dan. Dan has a policy that has a $2,000 out-of-pocket max. Sorry, $2,000 deductible. He has an 80-20 plan and it has an $8,000 out-of-pocket max. If Dan just spent a week in the hospital and he walks out of the hospital with a $102,000 hospital bill. So assuming that he's had no other medical expenses during the year, how much does Dan actually have to pay for his medical bill? Well, first he's going to have to pay that $2,000 deductible, which leaves $100,000 left. He has an 80-20 plan. So 20% of $100,000 is $20,000. So that's where he's responsible for there. But then his out-of-pocket max is going to kick in at $8,000. So he's only going to have to pay $6,000 of that $20,000 coinsurance, because once he's paid his $2,000 deductible, that only leaves $6,000 to get to the $8,000 out-of-pocket max. Now, I'm not suggesting that $8,000 is not a lot of money, but it's certainly better than $20,000 and much better than $102,000, which is where he started. So in the worst case scenario, we know what you're going to have to pay out of pocket if you get a huge bill like that. This scenario and explanation is actually in one of our animated videos called Health Insurance Basics. So if you want to hear that again, or you think somebody else might benefit from hearing it, you can share that video. And because it's important to know how to pick a plan, let's look at some options. So this is a marketplace plan, but you could do this to compare various options at work or from other resources as well. So here we have 3 plans that are available to this person. They have a bronze plan with a $200 premium, a $6,000 deductible, and an out-of-pocket max of $8,000. They could choose a silver plan that has a $275 premium, a $2,500 deductible, and an out-of-pocket max of $6,000. And lastly, they could choose the platinum plan, and that one has a $400 premium, a $0 deductible, or $2,000 out of pocket. So assuming that you're going to hit your out-of-pocket maximum during the year, because when we're talking about cancer care, the likelihood is pretty high of that happening, can you tell just by looking at these plans how much they're actually going to cost you by the end of the year and which option will cost you least? Well, I know that I certainly cannot. I need to do the math to figure it out, right? So the way to do the math is that you take the monthly premium and you multiply it by 12, because that's how much it's going to cost you to have the plan for the year. And then you add that to the out-of-pocket max, because that's the most that you're going to have to pay for your medical expenses during the year. So in this example, it turns out that the platinum level plan ends up saving you more than $2,000 over the course of the year, even though we get sticker shock when we see that $400 monthly premium. It seems so much more expensive, but it's really not when we take into consideration the out-of-pocket max. So, and that's because, you know, when we are thinking about our health insurance, we're not necessarily understanding how the out-of-pocket maximum works. We don't take it into consideration when shopping for health insurance or comparing options. Important to note that this out-of-pocket max is going to apply to in-network providers only. Typically, there is a separate out-of-pocket max for out-of-network providers. So doing the math is really important, but it's not just about the plan's cost, right? So when you're thinking about picking a plan, you also want to think about whether your providers are covered in network and what type of plan it is. Is it a PPO, an HMO, a high deductible? We have on our website a whole bunch of resources that can help you think through these options, including the animated video that I mentioned earlier, as well as a worksheet that can help you compare plans. So having adequate health insurance is actually the #1 way to manage your medical bills. And this Post-it note just reminds us that people need to purchase adequate plans, understand those plans, and then utilize the plan to the most effectively that they can. Using in-network providers is super important. And then also using your out-of-pocket max to your advantage. So one way to do that is to schedule anything else that you can within the same plan year to keep it all within that same out-of-pocket max. But even if you have the best health insurance policy that there is to buy, there's still going to be medical bills and out-of-pocket costs. So let's talk about how we as consumers can navigate those costs. So there are ways to lower bills before you even get care. And with a lot of what we talk about at Triage Cancer, we really promote communication. So it can feel really awkward to discuss money while also discussing your healthcare, but it's really absolutely appropriate to know what your treatment is going to cost you, and if there are any programs available that can help you cope with the cost. So healthcare is the only way that we purchase in this way, where we go and we have no idea how much it's going to cost us. And then 3 or 4 weeks later, we get a bill and we're required to pay that bill. We don't get work done on our car or our house without getting an estimate. We don't buy a washer or a dryer this way. Those things just wouldn't happen. And so we want people to be more comfortable with talking about costs whenever possible with providers before they get their care. Many hospitals do have ability to pay programs and discounts or financial assistance. Sometimes they'll even waive a portion of the bill. To find out about that, you can talk with the social worker or a patient navigator or contact the financial assistance office at the hospital. Another option is to ask your health insurance company if they have a case manager available that can help you work through these processes. I do caution people to remember that that case manager still works for the insurance company and not for you, but it can be really helpful to know that you're going to speak with the same person every time you call the company. The other thing you want to do is make sure that you confirm with your provider that they are in fact in network for your insurance, and that every time they refer you to somebody else, that that person is also in your network. And in addition to talking with providers about the cost of care, you can also explore getting independent lab work done. Because when it comes to labs and tests, they do not all charge the same amount. You can get a list of the tests that your doctor wants you to have performed and then shop around for the lowest prices. Healthcarebluebook.com is actually a website where you can go and you can put in your zip code, and it's going to give you the fair market value of tests in your area, which I think is a really good place to start. And then, if possible, you can try to group your follow-up appointments so that you only have to pay one copay instead of paying multiple over multiple days or time. Finally, there may be a less expensive or generic medication or potentially a less expensive course of treatment that might be equally effective for your treatment. But if you never talk to your doctor about the cost, they're just going to keep prescribing what they're used to prescribing. And we don't want somebody to take a less effective course of treatment just for financial reasons. But if it's equal, then this can be a good strategy to try and lower those costs. We at Triage Cancer have a partnership with NeedyMed, which is actually another nonprofit, and they provide this drug discount card. So these cards are really useful because when somebody has to go to the pharmacy to get a prescription filled, they can ask how much it would cost for them to use their insurance or to use this card. The cards do not require any sort of registration, and there's no name on it. It can be passed around the family or to friends. And you can download them on our website for free. And what's really useful about it is that it's a reminder to have that conversation with the pharmacist, because even if your medication is not on this particular program, the pharmacist may know of one where it is on the program. And there are other programs out there as well, like GoodRx or Mark Cuban's Cost Plus Drugs, which might be able to help save you money. So there are ways to save on prescription drugs. And then once you've received your care, you're probably going to get a whole bunch of correspondence, right? From your insurance alone, you might get 3 pieces of mail. One saying that they've got the claim, one saying they've processed the claim, and then the last one is the most important, and that's the explanation of benefits, or the EOB. And you can usually tell that it's the explanation of benefits because somewhere on it, in large letters, it's going to say this is not a bill. But that EOB is going to give you an idea of how much you're going to have to pay out of pocket. And they can be pretty difficult to decipher. And there are some websites that can help you try to figure them out. But I'm going to walk you through one now. So this is an illustration of the types of information you're going to find on an EOB. And each company presents them a little bit differently, but they all should have this minimum level of information. So the first telltale sign, like I mentioned, is that it says somewhere on there, this is not a bill. And then you're going to see information about the policyholder and who the claim is for. In this case, the policyholder is Ida Don't Want to Pay, and she's also the one who received the services. And then you're also going to get some sort of summary of the claim. And then in the chart, you're going to see the date of service, a description, and possibly a CPT code. You're also going to see the amount billed and the amount not covered. And the difference there is going to be between what your provider billed to the insurance company and what the insurance company has contracted with them to pay for the service. So here you can see that the insurance company only agreed to pay $50 for the immunization and $15 for one of the lab services and $10 for the second one. So then the next column shows that Ida has a 20% coinsurance and that she's likely to owe $5 to the provider. And then lastly, the EOB should show somewhere on there how much you've paid towards your deductible for the year and how much you've paid towards your out-of-pocket max, both as an individual and for your family. And if you have questions about the billing codes or the costs of things, you should definitely call your insurance company or your provider to get clarification. And as I talked about before, keeping an eye on the out-of-pocket max is really helpful. Then the last piece of information that you're going to get is from your actual provider, and that's going to be the bill itself. And the challenge in this system is that those pieces of communication don't always come in this order. And sometimes they don't always come in the same way. So sometimes they're snail mail and sometimes they're email. And many of the providers are actually faster at billing than the insurance company is at actually processing the claim. So if someone pays their bill before they look at the EOB, they might end up paying more to the provider than they actually owe. And then they're in a situation where they have to go back to the provider and ask for money back, which is just another additional step. So we suggest that you wait until you get the EOB before you pay the bill itself. But also communicate with your provider about what's happening. So don't wait and let the due date come and go and just never communicate, because then the provider is going to think that you're not going to pay. So what I would do in this situation is just call up my provider and say, hey, I haven't gotten my EOB yet. Can you push back the due date for my bill? Or could you make a note in my file and then wait to get your EOB and be able to compare the two together? So once you do get the EOB and the bill, we definitely recommend reviewing them both for accuracy. It's really important to stay diligent and check that your bills are accurate, dispute them if there are problems, and if you believe that a procedure or treatment should have been covered and it wasn't, you should know that you have the right to appeal that decision. I'm going to get more into that a little bit next. So when you're reviewing your bill and your EOB, make sure that you're looking for things like an incorrect number of something. For example, you might be billed for 11 surgeries instead of 1 because somebody hit the 1 twice. Or you could be billed for things that had been ordered but never happened. Like maybe it was ordered for you to go get a certain blood test and then the provider changed their mind. You should not be billed for those things. And medical billing is a human process, and we need to remember that, and we know that humans make mistakes. So we've seen all kinds of crazy things over the years, but it's super valuable to make sure that you're actually being billed for the services you received. And if you have extensive bills, you could consider talking with a professional bill reviewer or a medical claims organization. Each of these services is set up a little bit differently. Some of them will charge you an initial fee, and some will charge you based on what they're able to recover. And as I mentioned before, sometimes the insurance company denies coverage, right? And one of the things that we think is incredibly beneficial for people to understand is that they don't have to take no for an answer when that happens. When it does happen, as consumers, we have 2 rights or opportunities for an appeal. The first of those is called an internal appeal. And this is essentially where you're going back to the company that said no and say, please reconsider this. And then the second opportunity is external appeal. And that's where you go to an independent entity and have them look at the situation and decide whether or not the insurance company should have covered the claim. Now, I fully recognize that in this process, we're now asking patients and caregivers to take on yet another thing while they're in the midst of dealing with all of the things that come with cancer diagnosis. However, we do have data that tells us that somewhere between 40 and 60% of all of the claims that get appealed are actually decided in favor of the patient. So that means that 50% of the time, the insurance company is getting it wrong when they deny coverage. When we're talking about managing medical bills, the appeal system is super valuable. But here's the problem. Consumers don't typically appeal their denied claim. So even though we know that approximately 50% of the time the insurance company is getting it wrong, less than 0.2% of all denied claims get appealed. And because we think that the appeals process is such a valuable tool, we have a whole bunch of resources on our website that can help you through the appeals process. We also have an animated video, which is a really great way to learn more about appeals if you've never heard of them before. So dealing with finances in the midst of treatment or when you're experiencing things like chemo brain can be particularly challenging. And so we have some ideas of useful things to consider. One of those is to set up automatic billing. So many credit card companies, mortgages, utility companies can work on auto pay, where you don't even have to worry about whether your bills are getting paid because it just automatically happens. Another option would be to use your online bank's bill pay system. So you have to go in and manually schedule the bill to be paid, but then you don't have to deal with mailing them or trying to figure out whether or not you've sent the bill or the payment out. It also keeps a record then of when something got paid. And then maybe you want to consider like a bill spreadsheet to try and keep track of things. And the way that you can set those up is to just put down the side all of the bills that you pay each month, and then across the top each of the months of the year. And that way you fill it in as you pay the bills, and if there's a box or an empty spot, you know you missed something and need to pay it. And of course, it's really important to try and stay organized through the whole process, but that's usually easier said than done. This pile of papers here on the desk is not a great organizational system. And any system that you use can be anything that makes sense to you. So some people want to use file folders or 3-ring binders. Some use electronic files or a pre-built planner. And there are actually a few systems out there that are cancer specific that you could purchase, like the Cancer 101 Planner, the Livestrong Guidebook. I'm not necessarily endorsing any of them, but it can be helpful to use something that's already created. And then there are also some electronic services that you can use to store the information. It doesn't matter which system you actually use, as long as you pick a system and actually use it. So paperwork can get super overwhelming, but if you can come up with a strategy to deal with it, that can be helpful. We also tend to have a lot of people asking us what they can do to help, and you could engage people who are willing to help in helping you get organized. At Triage Cancer, we actually developed a tool that can help you stay organized and track your medical bills. And we think that this is super helpful because it can help you keep all of the information in one place. So to use it, you input your deductible and your out-of-pocket max. And then as you put in the bills that you've paid, it updates it and helps you plan both for the year and helps you know which bills got paid. You can find this tool on the Navigating Finances page of our website at triagecancer.org. And then lastly, it's a good practice to keep track of all of those medical bills and payments and EOBs, as well as pre-authorizations, meals, travel costs, etc. You might need these as a part of the appeals process, but they can also be useful for other things like submitting bills to HSAs or FSAs. And then even if you're not doing either of those things, some of the expenses that are paid toward healthcare can in fact be tax deductible, but you do have to keep a record of that to claim them on your taxes. Now, if you're in a situation where you owe the healthcare providers, you should, again, try talking with them. So we suggest doing this before they've turned over your unpaid bills to collections agencies, and that's going to help protect your credit. If you can't make the payment on time, you can always ask for more time. You can also check to see if they'd be willing to negotiate a payment plan or accept a lower lump sum payment. And this actually applies to other people who you owe money to, like your landlord or student loan company or credit card company. You would be surprised how flexible creditors can actually be, especially when they've known that you are facing a hardship like cancer. The motto that we like to remember here is that it can't hurt to try. One word of warning, please be careful when you're considering paying a medical bill by credit card. Most credit cards have really high interest rates, and that means that you may end up spending more than necessary. It's also not recommended that you take a loan out on your home, like a second mortgage or a home equity line of credit, to pay your medical bills. Because then you're turning your unsecured debt into secured debt, and then you could be at risk of losing your home if you then can't make those payments. So recently, the 3 major credit reporting agencies announced that starting next month in July, they will no longer include certain medical debts on credit reports. And next year, they're going to report even less medical debt. And this step that they're taking is going to remove about 70% of medical debt that's in collections from credit reports. And it's really helpful because the CFPB, or the Consumer Financial Protection Bureau, says that its research shows that medical debt is less predictive of a person's ability to repay than other kinds of loans. So it should make it easier for people who are carrying medical debt to be able to get credit. Now, if after all of that, you still have questions or you want to know more about what you can do in your particular situation, whether it's medical bills or health insurance or any of the other topics that I mentioned earlier today, we have a new program at Triage Cancer that's called the Legal and Financial Navigation Program. So we've always provided some one-on-one assistance to individuals who've been diagnosed with cancer, caregivers, and healthcare professionals. But we have seen over the years the need for our services grow, and we want to continue to meet that need, so we created this program. The fastest way to set up an appointment is to go to triagecancer.org/get help. And there you would fill out a brief intake form, and then you'll be able to schedule an appointment with somebody from our staff. We would then talk with you about your situation and provide you with accurate information, explain your potential options. We usually provide some written resources and then try to empower you to take the next step. Our legal and financial navigation program is open to individuals diagnosed with cancer, caregivers, and healthcare professionals. And it is a free service, so you're not paying for it. I also hope that today is not going to be the last time that you interact with us at Triage Cancer. So up on this slide, you are going to see several ways that you can connect with us, including by social media or checking out our blog and events like I talked about before. So with that, I thank you for listening, and I will hand it back over to Sarah to answer questions.
So there's still time to type in your questions in the Q&A feature, so feel free to do so. Alyssa, this was a great presentation, and free always sounds nice to people. So thank you for all these resources that you provided today. I'll just start off with a question. Many of the GIST patients are on Medicare, and you had mentioned that, you know, some quick guides and resources regarding choosing a Medicare plan, but I don't know if you can talk generally when somebody has a rare cancer with like a high tier drug. Do you have like, you know, some guidance in terms of how they're choosing that Medicare plan? Like, is there like a quick and easy like go to that they should get? And then in addition to that, I think sometimes people don't know if they should be electing a supplemental plan or not for the medication.
Yeah, so it's really going to depend on each person and what their treatment looks like, right? And so we do have some resources that help compare plans, which I think are really helpful. There's like a worksheet where they can put in all of the information, the cost of the monthly premium, the things that are important to them in terms of coverage, and figure out which plan is best for them. And there's never like a one size fits all answer to like what's the best plan. It really depends on priorities. And, you know, some people spend some time in one part of the country for part of the year, and then another part of the country for another part of the year. And so in that case, they might not want an Advantage plan, and they might want traditional Medicare, whereas other people would want traditional Medicare if they're like staying in the same place all the time, and then get a supplemental plan. So that it really depends on the situation.
Do you know anything also about like some of those patient assistance programs for the cancer patients that sometimes they're limited if cancer patients can be part of it or not?
I apologize, my dogs are going nuts downstairs. But,
okay, but for yeah, like for if they aren't eligible for the support, the patient support through a pharmaceutical company program because they're a Medicare beneficiary.
I'm not familiar with that.
Okay, all right. We have another question. Thank you for the information. For how long should we be keeping our medical records?
I think they typically say 7 to 10 years so that you have them.
Okay. Any other questions? People feel free to type in. We still have some time. I think you covered a lot of bases in the presentation. So, and you definitely think some great information. If people want to have access to the slide deck, would you be able to make it available?
We don't typically share the slide deck. I may be able to share a PDF of it, but I will have to check to make sure.
Okay.
Okay.
Okay, so no other questions came in. So it sounds like you covered a lot in this area. So
Well,
thank you. Yeah.
I hope everyone has a great afternoon, and thanks for having us.
Thank you. Thanks for presenting today. Everybody have a good day. Bye.